Welcome to the Care Certificate by the World of Work for WOW Homecare employees. This is Unit CC1. Understand own role and responsibilities in adult social care. Understand own role. Describe main duties and responsibilities of own role. Your main duties and responsibilities as an adult social care worker depend on your specific role, but generally include providing personal care such as bathing, dressing, and toileting, supporting individuals with mobility and daily living tasks, promoting independence and dignity in care, following care plans and risk assessments, observing and reporting changes in service users' conditions, administering or assisting with medication if trained and authorized, communicating effectively with individuals, families, and professionals, safeguarding individuals by reporting concerns, following health and safety policies, infection control measures, and GDPR regulations. List the standards and codes of conduct and practice that relate to own role. Several key standards and codes of conduct govern adult social care work. Code of Conduct for Healthcare Support Workers and Adult Social Care Workers in England. The Health and Social Care Act, 2008, Regulated Activities. Regulations 2014, Care Quality Commission, CQC. Regulations and Fundamental Standards, the General Data Protection Regulation, GDPR, 2018. The Safeguarding Vulnerable Groups Act, 2006. National Occupational Standards, NOS, relevant to the role. Organizational policies and procedures. Explain how own experiences, attitudes, values, and beliefs may affect the way you work. Personal experiences. Past experiences with care as a caregiver or recipient can shape how you interact with service users. Attitudes. A positive, empathetic attitude enhances care quality, while biases can lead to unfair treatment. Values. Core beliefs like respect, dignity, and independence influence how you support individuals. Beliefs. Religious, cultural, or ethical beliefs should not affect the impartiality of your care, but can help you respect service users' backgrounds. Identify the different opportunities for professional and career development in the sector. Further education options include NVQs, diplomas, or degrees in health and social care. Specialist training can be in areas like dementia care, palliative care, medication administration, or mental health support. Apprenticeships are available, such as advanced or higher level apprenticeships in social care. Career progression might involve moving into senior roles like team leader, supervisor, or registered manager. Finally, professional registration can be achieved by becoming a registered care worker or nurse through further training. Reflect on training completed as part of induction to support your own role and career development in the sector. Induction training includes mandatory training in safeguarding, manual handling, health and safety, and GDPR. It helps in understanding company policies, procedures, and service user rights. This training provides a foundation for continuing professional development, or CPD. It also enhances your confidence and competence in delivering care. Be able to work in ways that have been agreed with the employer. Let's describe employment rights and responsibilities. Rights include fair pay, safe working conditions, training, and protection from discrimination. Responsibilities involve following policies, maintaining professional conduct, safeguarding service users, and working within your competence. Provide the aims, objectives, and values of the service in which you work. Aims: delivering high-quality, person-centered care. Objectives: meeting individual needs, promoting dignity, independence, and choice. Values: compassion, respect, accountability, teamwork, and excellence. Explain why it is important to work in ways that are agreed with your employer. Ensures consistency and care. Maintains legal compliance and professional standards. Protects service users' rights and well-being. Reduces risks and liabilities. Demonstrate how to access full and up-to-date details of agreed ways of working that are relevant to own role. Reviewing policies and procedures, checking care plans and risk assessments, attending team meetings and training sessions, using employee handbooks and online resources. Demonstrate working in accordance with the agreed ways of working with the employer, following policies on medication, safeguarding, and manual handling, providing care as outlined in service users' care plans, using PPE and infection control measures properly, recording and reporting incidents accurately. Explain how and when to escalate any concerns in line with organizational policy or ways of working. If you witness abuse, neglect, or unsafe practices, report immediately to a line manager. Follow the whistleblowing policy if concerns are not addressed. Report health and safety, risk, or equipment failures to the appropriate department. Describe why it is important to be honest. Identify where errors may have occurred and to tell the appropriate person. Maintains trust and professional integrity. Ensures mistakes are rectified to prevent harm. Supports a culture of learning rather than blame. Protects service users' safety. Understand working relationships in adult social care. State main responsibilities to the individuals being supported, as well as key people, advocates, and others who are significant to an individual. Providing safe, person-centered care. Respecting choices, dignity, and confidentiality. Communicating effectively with families, advocates, healthcare professionals, and support networks. Explain how a working relationship is different from a personal relationship. Working relationships are professional, bound by codes of conduct, and focused on service user needs. Personal relationships are informal, based on mutual choice, and not governed by workplace policies. Identify different working relationships in adult social care settings. Colleagues and managers, healthcare professionals like nurses, doctors, and therapists, family members and advocates, volunteers and community workers, external agencies such as the Care Quality Commission and local authorities. Be able to work in partnership with others. Explain why it is important to work in teams and in partnership with others. Ensures coordinated care and support, promotes better communication and problem solving, helps to share knowledge and resources. Explain why it is important to work in partnership with key people, advocates, and others who are significant to individuals being supported. Supports personalized care planning, ensures service users' best interests are represented, encourages family and community involvement. Demonstrate behaviors, attitudes, and ways of working that can help improve partnership working. Active listening and effective communication. Respecting diverse views, being open to feedback and compromise. Demonstrate how and when to access support and advice about partnership working, consulting managers, mentors, or colleagues, using multidisciplinary team meetings, accessing training or professional guidance, resolving conflicts, using clear professional communication. referring to organizational policies, seeking mediation if needed. Thank you for listening. Please now complete the questions for this unit.